Welcome to our channel. Today, we're exploring the CHARM alternative trial, which investigated the efficacy of Candesartan in heart failure patients with reduced ejection fraction who are intolerant to ACE inhibitors. Let's dive into the findings. In patients with heart failure with reduced ejection fraction, or HFrEF, left ventricular ejection fraction, or LVEF, less than or equal to 40%, New York Heart Association, or NYHA, Class 2I4 symptoms, and intolerance to ACE inhibitors, do angiotensin receptor blockers, or ARBs, reduce congestive heart failure-related mortality or hospitalization with an acceptable side effect profile compared to placebo? The use of the ARB Candesartan in symptomatic HFrEF patients intolerant to ACE inhibitors was well tolerated and resulted in a 20% reduction in cardiovascular mortality and a 40% reduction in hospitalization for heart failure. ACE inhibitors have been a cornerstone in HFrEF management, improving survival as shown in landmark studies like Consensus and Solved. However, ACE inhibitor intolerance, particularly due to cough, affects up to 10% of patients. ARBs, like Candesartan, offer an alternative by inhibiting the angiotensin II receptor without increasing bradykinin levels, thus avoiding the common side effects of ACE inhibitors. The CHARM alternative trial demonstrated that Candesartan significantly reduces cardiovascular mortality and heart failure hospitalizations in patients who cannot tolerate ACE inhibitors. The CHARM alternative trial was a multi-center, double-blind, randomized, placebo-controlled study. It enrolled 2,028 patients with LVEF less than or equal to 40% and NYHA Class 2I4 symptoms who were intolerant to ACE inhibitors. Patients were randomized to receive either Candesartan or placebo and were followed for a median of 33.7 months. The primary outcome was cardiovascular death or hospitalization for heart failure. Candesartan significantly reduced this composite outcome by 30% compared to placebo, with 33% versus 40%. Secondary outcomes also favored Candesartan, with notable reductions in cardiovascular death and heart failure hospitalizations. Candesartan was generally well tolerated. However, it was associated with higher rates of hypotension, increased creatinine, and hyperkalemia compared to placebo. Importantly, these side effects did not lead to a higher discontinuation rate compared to placebo. According to the 2022 American Heart Association, or AHA, American College of Cardiology, or ACC, and Heart Failure Society of America, or HFSA, guidelines, ARBs are recommended for HFrEF patients who are intolerant to ACE inhibitors. This trial supports the use of Candesartan as an effective and safe alternative, offering significant benefits in reducing cardiovascular mortality and heart failure hospitalizations. In summary, for HFrEF patients with LVEF less than or equal to 40% and NYHA Class 2I4 symptoms who cannot tolerate ACE inhibitors, Candesartan provides a valuable alternative, significantly reducing cardiovascular mortality and heart failure hospitalizations. These findings highlight the importance of ARBs in heart failure management. Thank you for watching. Don't forget to like, comment, and subscribe for more insights into heart failure treatment and other medical advancements. Subscribe button and links to related videos. This is your source for trusted cardiology insights. Stay informed and stay healthy.